When I first started in my position as an advanced care planning coordinator, I'd often talk with my supervisor and express frustration that I wasn't always able to engage all the patients that I met with in ACP conversations. But my supervisor always told me to remember that I was planting a seed, and hopefully that the people I met with would remember our interaction. And when they were ready to have these conversations, they would reach out to me. So I often remind myself of what she said, because I think those were very wise words. We're planting seeds. My role here at the hospital is a little bit different. I meet with patients at the bedside on a daily basis to provide education about advanced directives, help people think through their wishes, what's important to them, perhaps facilitate conversations with their family members, and then to help them document their wishes in an advanced directive. For people that already have an advanced directive, again, we always encourage them to have them included in their medical record. Another part of my role is to offer quarterly presentations to our cardiac and pulmonary rehabilitation program participants. And then I also offer a monthly advanced care planning help session to community members. I'm really happy to be a part of the ACP initiative at Howard County General Hospital because I understand the importance of this work. As an ACP coordinator in the hospital, that's my only role in the hospital. So all of my time is devoted to that. I have the time to sit with patients. Sometimes we'll sit and have conversations for up to an hour at a time. If they're interested in actually completing their advanced directive, I sit with them. We go through the document page by page. They ask questions that they have. We try to include family members if they're visiting or if they're able to participate over the phone. It's just a really unique opportunity, and patients really do appreciate that, because I hear a lot that they understand the importance of completing an advanced directive. They know that it's something that they should do for themselves, but they've always backburnered it. So to have someone who can sit with them and to help facilitate these conversations is a huge benefit to them. I've also heard that they were very intimidated by the process, by the actual paperwork itself, or whether they're doing it electronically through my directives. It's just very intimidating to them. So it's nice to have someone who can sit with them and go through this process with them. From my perspective and my role in the hospital as the ACP coordinator, I think there have been many successes. People are more familiar with advanced directives. I even had a patient one time say to me, it's like, what's all this talk about advanced directives lately? Because he was hearing it from his primary care physician during his annual Medicare visit. We ask when the person comes to the hospital. I follow up at the bedside. So they're hearing this a lot. And I think that the ACP initiative at Howard County General really benefits the organization because it allows us to follow through on our promise of patient-centered care. It allows a patient to continue to drive their care. There are several important lessons that have been learned from the ACP initiative at Howard County General Hospital. We've learned the importance of a team approach when it comes to advanced care planning. Here at the hospital, it begins with our admissions staff when they ask our patients if they have an advanced directive. And then it continues during the initial nursing assessment and the placement of advanced care planning referrals. It's asked again. We learned the importance of patients having advanced care planning conversations with a variety of staff. Here in one facility, they have the ability to speak with a physician if they have concerns about not only their own condition, but maybe some of the choices that they may be making. They have the option of speaking with social workers for emotional support, palliative care providers, chaplains, and myself. So we all need to work together to educate our patients and our family members about the importance of having these difficult conversations as well as documenting our wishes. To be truly effective, I believe there needs to be a team approach. Another important lesson that we learned is that we need to normalize these conversations. People can initially be very frightened when you start asking them who you'd want speaking for you if you can no longer speak for yourself, or what their end-of-life wishes are, especially when they're in the hospital. But if people are having these conversations across a variety of settings, with their primary care physicians, at their workplace, the hospital, their homes, their places of worship, I believe the fear and stigma associated with advanced care planning will lessen. Another important thing that we've learned is the importance of educating our staff at the hospital. We're required to ask all of our patients if they have an advance directive when they're first admitted. So it's important that staff are able to address at least basic questions about them and be aware of advanced care planning resources that are available within the hospital. To that end, last year during National Healthcare Decisions Day, we decided to focus on our staff, and we visited staff on the units to provide information about advanced directives, answer any questions that they may have, and encourage them to have conversations with their loved ones about their wishes. Because it's much easier to help others when you've experienced that process yourself. And how can we encourage others to have these conversations when we haven't done it for ourselves?